there's 2 cameras, so good to know.
I guess what I'm trying to say is.
What should I ask?
Future teachers.
That's a good question.
No,
Absolutely not.
I said nothing.
Okay, we're gonna get started with a couple ACDA reminders real quick, and then I'll do my presentation. So Cantate is this Friday. What time are you arriving if you're volunteering? 7:45 a.m. What are you wearing if you are volunteering?
Black.
Black and red.
Oh, what?
Yes, black and red. That is
Black.
black.
Does
Black
that
and red.
count
So I'm
for
wearing
bus greeters as well?
Yes.
Okay, I'll write
Bring concert attire to change. We'll have bagels and coffee and tea provided, and plan to stay afterwards to break down if you're here for the concert. So that'd be extremely helpful. Open mic night is November 2nd at 7 p.m. in the band room. Come, sing songs, invite your friends. It should be fun. There is food, so that's always a plus. Laurel Sing Series is November 7th. Laurel, do you want to say anything about that?
Sure. I'm going to be doing a presentation on music and advocacy. Yeah, so it should be fun.
Also, if you're interested in presenting next semester, please email an e-board member or fill out the form that is on our website. You can present about anything related to music. And then Scores Project. On Tuesday, October 30th, we're visiting the Keene Corral. We'll leave at 7 o'clock. Kat is driving, Tyler, Laurel, Hattie, and I are going. And then Wednesday, November 7th, we are going to leave at 6:30 to go to Monadnock Course, and Kat's driving. Grant, Corinne, Laurel, and myself are going. Anybody else want to tag along on any of those? I think that's a pretty full car, so.
I can only take 5.
Yeah.
Myself.
So that's good.
So, yeah.
That's it. Very good. We are going to go Christmas caroling on Saturday, December 1st from 12 to 2 p.m. Locations are to be determined. And then fundraisers, you should have all gotten emails and Facebook invites galore about these. Ramuntos from 4 to 9 p.m. You need to commit by November 11th via this link. It's also on Facebook. And then Yankee Candle, see the email that I sent out for all the very specific details regarding that. If you have not gotten your folder yet, it is in your mailbox in the student lounge. So I think most of you have yours now. Yeah. And that's it. Cool. That is my cat. We're going to sing. The lyrics are easy. It's hello, 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 hello. It's music time. So I'll sing it, and then we'll just sing it together, and then we might change up the lyrics a little bit. So, sound good? You can use your instruments for this too, and your voices. Sing with me.
It's music time.
Now listen.
Now clap your hands. Now clap your hands.
thing we could do.
Now pat your head.
Now pat your head. Now pat your head. Now pat your head. It's music time. Tyler, what's another thing we could do? Pass it off to somebody else if you don't know. Laurel.
Stomp your feet.
Now stomp your feet. Now stomp your feet. Now stomp your feet. It's music time. One more, shout it out. Snap. Now snap your Now
Drop.
snap your hands. Now snap your hands. Now snap your hands. It's music time. Hello, hello. Hello, hello. Hello, hello. It's music time. So that song is great for any session with anybody with music therapy. It's very adaptable. You can add many different verses. You can put in goals for like physical things. So if they're working on like making an M sound, you can say like, now say M, or something like k, or anything. Snapping fingers, that can be difficult. Reaching out to grab something. So there's a lot of different ways that can be used. But now I'm going to tell you why it should be used. Maybe. So your brain and music, a lot of these facts you already know because most of you are musicians. So your heartbeat mimics the music that you listen to. Music also triggers the release of dopamine. What else triggers the release of dopamine?
Hugs.
Hugs.
Friends.
Friends.
We talked about this in the same class today.
It's a pleasure hormone, so
Pigs.
pigs, yes, pigs for me, release. I love pigs. Okay. So musical instruments, as most of you know, improve your fine motor skills and also reasoning skills. And then stimulates the entire brain. And then regular playing music will alter your brain structure, which is why we practice. And then it can repair brain damage. So speech is processed in the left side of your brain, while music is processed in the right side of the brain. So a person that has brain damage, singing, which connects both the language piece and the music piece, will repair damaged neurons across the hemispheres. Okay, so we're just going to go through, and these are also on your piece of paper so you can fill out the right answers. But work with children with autism to improve communication capabilities. True or false?
True. You can't just give away.
Yes, true. A piano player in the lobby of a hospital. True or false?
No.
Wait. A piano player in the lobby of a hospital.
Does that
True or false? Is it music therapy?
True. Sort of, but not like your license.
Relaxation function.
Yes or no?
False. I'll explain why after.
That's what I thought at first.
Nurses playing background music for patients.
No. True. False.
True.
Because if 2 was false.
False.
God.
Groups such as bedside musicians, musicians on call, music practitioners, sound healers, and music thanatologists.
I'm going to say true. Sound healers sounds. Honestly.
False.
What?
Why would
I
people
know
work?
nothing.
Work with older adults to lessen the impacts of dementia. True.
Kind of true.
Yes. True.
I was trying to say true.
Ooh.
A few more. A person with Alzheimer's listening to an iPod with their favorite music.
No. True.
Oh.
False.
I wanted to like explain them. I don't know.
A person playing guitar at a nursing home.
No.
Work with hospitalized patients to reduce pain.
True.
Is it church monster?
Yes. Acquire singing on the pediatric floor of a hospital.
No.
False. Work with premature infants to improve sleep patterns and increase weight gain.
True.
True. Alright, what patterns did you see there?
Work.
Yes.
Oh.
Oh.
Yes, that is one of them, yes. But why wouldn't a person playing guitar in a nursing home count as music therapy?
They're not
You're just
licensed
listening to it.
background noise.
They're not licensed music therapists. As it is music healing, but it's not, it's music as therapy, but it's not music therapy. So you'll learn the difference. So AMTA is the American Music Therapy Association. They're a nonprofit organization that that set standards for education, advocacy. It's very similar to what we call NAFME and ACPA or MTNA. So music therapy is clinical and evidence-based. Music interventions are used to accomplish individual goals. So comparing that to music education, you have music goals, and you use music to satisfy goals such as rhythm, literacy, and pitch. So within a therapeutic relationship, needs addressed include physical, social, emotional, and cognitive. And then these clients' abilities that are accomplished during a music therapy session can be then transferred to other areas of life, such as work, relationships, and education settings. There's a lot of research that supports music therapy's effectiveness, dating back to 1940s with the World War II. The American Music Therapy Association didn't really develop until 1998, so it's a really new career. But as we all know, music is a culture that has been a part of humanity forever, dating back to Native Americans, prehistoric times. All right. So the client or patient must have some particular music ability to benefit from music therapy. This is false, or a myth. Musical training is not a prerequisite to benefit from music therapy intervention. The focus is on non-musical goals such as the physical, social, cognitive, and emotional needs. And the music therapist is trained to structure and facilitate music-based interventions tailored to the individual client or patient. Another myth is that one particular style or genre of music is more therapeutic than all the rest and works for everyone. As we all know, we all have very different musical tastes. So everyone in this room may not like classical music, and so everyone in this room may not benefit from a classical-based music therapy intervention. That being said, all styles of music can be useful in affecting change in a client or patient's life. The music therapist assesses the client or patient's preferences, circumstances, need for treatment, and goals. Types of music to be used are then determined as a part of the therapeutic process and need for assessment. So, music therapists complete an accredited bachelor's, equivalency, or master's degree program. This includes a 1,200-hour clinical internship. So the degree that I have here now is not an accredited degree, which is why I'll need to go to graduate school to get my master's. So I can do the 1,200-hour clinical internship. I was planning on going to grad school, so that's why this route works for me. So you take courses in 3 main areas, including musical foundations, clinical foundations, and music therapy foundations. So the musical foundations is what we all do for all of our degrees. And then the clinical foundations is the psych behind it, and then the music therapy foundations is the music therapy practices, the history, and the different techniques that combine the musical and the clinical. We You have to sit for board examination through the certification of music therapist. So like being a music ed, you have to take the praxis and then get your license afterwards. So for music therapy, we have a very similar examination, and you'll get your MTBC. Music therapists collaborate with a whole range of different professions, including mental health professionals, special educators, SLPs, physical therapists, occupational therapists, various doctors, and of course family members. So we have nursing homes and rehabilitation centers. In these places, the music therapist may work with patients with Parkinson's disease, Alzheimer's, hospice care, a wide variety of different diseases and disorders. And then they work at prisons and correctional facilities, so we'll work with inmates and children and teens that are in juvenile detention. Of course, mental health facilities, so you have the wide range of mental illnesses, including anxiety, depression, schizophrenia, bipolar disorder, obsessive compulsive disorder, agoraphobia. Crisis and trauma centers, so PTSD, military populations, and actually this is where a lot of music therapy, where the actual profession started rooting, was during World War II, and where like choirs or like musicians would go into VA hospitals and just play music, and they noticed the benefit of like their PTSD was actually getting better. And so that's where a lot of the research is actually founded, is in military populations. And then pediatric hospitals, cancer patients, NICU patients, wide range of different situations. Schools, early intervention centers, so people with autism spectrum disorder, Down syndrome, cerebral palsy, different learning disabilities, ADHD, various developmental disabilities. And then a lot of music therapists work in private practice, so they have their own private practice, they can have their own building, they also do a lot of contract work. They can be hired by hospitals and schools, but a lot of the times music therapists are working through private practice.
Michelle Muth. I'm a board-certified music therapist and owner and founder of M3 Music Therapy. I'd like to take a minute and show you what a music therapy session looks like. So I'm working with someone with autism and using the drums. And we're working on impulse control and learning to take turns. He needs to wait for me to play, he copies what I play, and vice versa. In the process of playing the drums with me in that environment, he's learning how to communicate and take turns. So if I'm playing on the piano with a young child, through the music and showing me what they want with the music, there's communication taking place and music being created. We begin to work on adding language skills into there by using words for them to request what they want. A music therapy session may look like we're just having fun making music or it's entertainment. But what was really taking place is some very strategic goals.
Hi, Carly. I'm so glad you're here today. Are you ready to go to music? All right, let's go. Hello, Carly. Hello, Carly. Hello, Carly. It's time to make some music. Hello. Oh, thank you. Very good. Oh, that sounds very good. It's time to make some music. That's it. All right, we're gonna have lots of fun today. Your turn. That sounds great. Oh, can you copy me? No. Excellent. Yes, how about this? We go pink, pink, blue, blue, green. Excellent! Nice job. Are you ready?
Okay, I'll do it. I don't know. It's okay. Okay.
Okay. 1, 2, and go.
Okay.
1, 2, ready, and play. And stop. Excellent listening, Carly. Good job. Can we play together this time? Let's play music together. Let's play music together. Let's play music together all day long. Can you hit the drum with your hand? Nice. Try it again. Oh, there we go.
Oh, a little bit like that.
A little bit further.
Yeah, until I can reach it. Too far.
Go. Let's play music together. Let's play music together all day long.
Thoughts, observations? Kiana?
It's more a question, what was she trying to work with that child? Because the previous video explained what they were working on with that.
Yeah,
child.
so
What was she
from what I
doing
can
with that
see, from what they were working on was they were working on some listening. So like when she was doing the drum and she said to stop, and then also some taking turns, doing some repeat after me, some color identification. If you notice, she was using colors on the piano. And just overall, just kind of like, there might also, if you notice the sensory environment of the second one, there was a sensory room. They had the mats, they had the balls, they had flags, and it was, so it was really kind of like making sure that the environment was comfortable for her. So there was probably more goals in there, but that was just kind of what I observed from that. Any other observations? music ed students? Differences?
I noticed that it was really focused on the child and what the child was comfortable doing, as opposed to like in a classroom setting with that age group where you would have it focused more on the entire class. So
Right.
with the individual session, that you could tell it was specified for that child.
Absolutely. Anything else, Kat?
Each of them, like, pretty much let them do whatever kind of came to them
Mhm.
and didn't try to, like, really constructively be like, this is what I want you to do. It was just kind of like, here's a basis,
Mm-hmm.
do whatever.
Exactly, yep. Cameron?
So, this isn't quite about the video, more for you. So when they have children with all these different issues or older people to work with, how do you decide which activities best suit, like, their
It's-
certain needs, like, for a specific one?
Absolutely, so it's definitely, definitely depends on the patient, on the client. I would say for like the elderly, you wanna like kind of look towards kind of like the music of their decade. So if you're thinking about elderly now, so that would be 30s, 40s music, 50s. And then if I'm working with kids, which is what I specifically want to do is work with kids, I'd be looking more at songs like Row Row Your Boat, Twinkle Twinkle Little Star, like the Hello song, the Let's Make Music Together song. So it's definitely patient preferred and depends on the client. But all of these, the great thing about music therapy and the great thing about music in general is that it's so adaptable to any population and any need. So, does that answer your question?
No, but I liked your answer.
Okay. I can't really, it really depends on the client,
Okay.
so, and the age. So, any other things before we move on? Okay. Okay, so if you're looking at how a music therapy session is constructed, because with music education, you are taught to create lesson plans. So you have an objective, you have a way to assess it, and you have a specific order plan. With music therapy, we have that when we're looking for like the objective or like how you assess a client. You're definitely working with the other doctors or other therapists involved, the other teachers. But so a goal of the session may be for the child to be able to tie their shoe. The goal may be for the child to be able to reach out and grab something like 3 times within the session without prompting. It could be something related to saying "k," being able to make that back sound. It could just be that like they could self-regulate. It could be related to brain activity. It could be related to breathing on their own. It could be related to anything. So whereas with music education, your objective is like this child will be able to read this rhythm like without help or with help depending on where you are in the lesson plan or the curriculum. So with that being said, there is kind of like a flow to every music therapy session, and it's definitely client preferred or whatever that client needs in the given moment. So like I did with the presentation, you open with a hello song. It kind of transitions them from the outside world because they could be coming from gym class and they may hate gym class, so they just need to calm down. So you may need to do some just some sensory stimulation because they may be on overload. So you might do like a quiet hello song. They may be coming from nap time and need to be energized, and so they need an exciting hello song, some movement with that. And then you would just kind of be like, what did we work on last week? Last week we worked on being able to tie your shoes. Last week we worked on being able to say all of these prepositions that was on like my English quiz last week. And then with schedule for the day, I don't know if any of you have worked in like a special educator, with a special educator or special education classroom, but a lot of times students with special needs have a visual like schedule board, and so they'd have like they're Velcroed and laminated, so you have like a picture that says hello, and then the next picture could be drums, or the next picture could be dancing. So you'd go over and like do could be like a free choice, goodbye. You go over and do this schedule with them and they get to pick the order. You have some say in what the order is, of course, but you do let them lead, but you may like kind of like be like, hey, actually let's do this here, but then we can do your thing here. So the visual, physical aspect of them making the schedule is very important. And then, of course, you do your various different interventions. So you have performing and playing, composing, improvising, receiving and listening, and movement. So performing and playing could just be something like singing the hello song, and they're like playing the drums with that. Composing, so a lot of times you could be like writing a song, they need to be able to like, I don't know, somebody give me an example. What should a kid know how to do?
Form a sentence.
Form a sentence. They may need help forming a sentence, and so you work with them with the structure of the sentence. So you have the subject, you have the verb, and you have, what's next? Adjective, object, yeah. So like you have the structure of a sentence. And so you may create a song. It could be a melody of their favorite song. It could be a simple melody like Twinkle, Twinkle, Little Star. And so you're working with them on that. And then improvising, it could just be some call and repeat on the drum. It could just literally be them like banging out and like squeezing the pig or whacking the bone whackers. That they just need to let out some energy. And then receiving and listening. So this would be like with instructions, or you could also do some lyric analysis. So lyric analysis is really good for people with depression and different mental health disorders. So they may listen to a song, and then they have to write down their feelings and do some lyric analysis. It could be guided imagery. And then movement. So movement, of course, is really important. It could just be, there's a song called Shake Your Sillies Out, and you just have to like shake, shake, shake your sillies out and just get some energy out. It could just be some movement where they need to like raise their arm up, and so like with the hello song, you did clap your hands, stomp your feet, pat your head, and different movements that need to be achieved. And then you always close with a goodbye song. You open with a hello song, you close with a goodbye song. This is really important for transitions back into the outside world. So other factors that come into a session are transitions and the environment. So say you have a student with autism. From what you know about autism, you may not know anything, and that's okay. What do you think the environment should be?
Calm.
Calm,
Not too loud.
not too loud,
Not distracting.
not distracting. What things can be distracting to people?
Toys.
Toys,
Other people?
other people. Yep. The lights, I flickered, but when I came in here, I was like flickering the lights on and off just to make sure that it wasn't too bright or too dim, or because I'm sensitive to light personally. Anything else?
Loud noises.
Loud noises. It could be what the floor feels like. It could be what the walls feel like. They may need like a yoga ball to like bounce so they can get the energy out. It could really be anything. It could be what their pencil feels like. It could be what their clothes are feeling like. So sensory is really important. And then let's sing, and then we'll do some questions and comments and stuff after. So the song is pretty easy. The lyrics are, look, come see, and then you say, look, come see back. And then I'll say a person's name and be like, this person's got a song inside of them. We're gonna stick with just song, but you can do a dance, you can do a rhythm, you can sing a note, do anything you want, okay? And if you don't want to do it, you immediately pass it off to somebody else. Yes, you can play your instrument if you want, Grant. Okay? It's pretty easy. We're gonna do it as a chant, not as a singing, because
see.
Laurel's got a song inside of her. Look, come see.
Look, come see.
Grant's got a song inside of him. Look, come see.
Look, come see.
Kat's got a song inside of her. Look, come see.
Look, come see.
Kiana's got a song inside of her. Look, come see.
Look, come see.
Felicity's got a song inside of her. Look, come see.
Look, come see.
Emma's got a song inside of her. Look, come see.
Look, come see.
Megan's got a song inside of her. Look, come see.
Look, come see.
Brian's got a song inside of him. Look, come see.
Look, come see.
Cora's got a song inside of her. Look, come see.
Look, come see.
Corinne's got a song inside of her. Look, come see.
Look, come see.
Hattie's got a song inside of her. Look, come see.
Look, come see.
Tyler's got a song inside of him. Look, come see.
Look, come see.
Emily's got a song inside of her. Look, come see.
Look, come see.
Kyle's got a song inside of him. Look, come see.
Look, come see.
Everyone's got a song inside of them. So I love that one as it's a great icebreaker. And you can use it for names. You can use it for also just any reaction. So one thing that's great about music therapy is that even if somebody is like 75% brain dead, they will have some reaction to music. So Emma was in our adaptive music class last semester, and we went to Cedar Crest, and we got to just go around and play music for them. And like even the smallest like eye movement, the smallest like licking of their lips, smallest like twitch of their finger, that is a reaction to music, and that is important. What's really interesting is with Alzheimer's patients, so the part of your brain that holds music isn't affected until the last stage of Alzheimer's, just before death. And so music therapy, music is so helpful in retrieving memories and just keeping somebody's like spirit alive all the way through these stages of Alzheimer's. So it's really cool. Okay, so could I have your index cards? I'm going to read some of these, and then we'll do just a few more questions. Okay. If it's blank, you don't have to give it to me.
Not done yet. Multiple questions.
If you have multiple questions, you don't have to write them down. You can ask them afterwards.
That just means you're better.
Great.
I have 3 questions.
It's only cute when
The
it's
first one's kind of dead now.
that
because
far.
of the presentation.
Okay. So I'm just going to read these off, and then we'll open the floor up to more questions and comments, okay? So can I incorporate this with teaching? Absolutely. So if you haven't already, you'll be taking adaptive music the spring of your junior year. And Dr. Safini is great. You learn, so with that, it's mainly like inclusion techniques. So if you have a choir and you have a student with autism that the sensory environment is just really off, like it's just off. So, or they have trouble following music, you can color code the music. You can, and then you can also have like a buddy, a choir buddy, and that will help them. You can think about your music choices. If they are nonverbal, then you can give them some sort of instrument. If they can't hold the instrument, there's adaptive ways to hold instruments, and they can, any participation is what matters. And then like in general music, with this, you can have a little place for them to go if they just need to calm down, just like in the corner. And you can have like some sort of cue with the teacher, like the student and the teacher can have some sort of like cue. But it's absolutely, you can use this in music. It would be adaptive music techniques with teaching. So, does that answer the person's question? What is the music therapy education schooling system like? Is it a growing profession? Great question. So yes, it is a growing profession. I'm really excited because by the time I get my master's degree and get board certified as a music therapist, there's going to be so many job opportunities. There are 70 undergraduate universities and colleges in America that offer an undergrad degree in music therapy. It's kind of unfortunate that only 2 of those are in New England, Berkeley and Anna Maria College, which neither of them I wanted to go to, and I wanted to stay in New England. But there are so many in New York, Pennsylvania, Florida, Minnesota, Missouri, California, Texas, Kansas, Montana. I can't name off all of the states.
So
But-
everywhere but here.
What?
So everywhere but here.
Everywhere but New England, but it is still growing. There's 3 music therapists now in Maine. There are at least a dozen in Vermont. There's probably a dozen in New Hampshire. There's several in Massachusetts, especially the Boston area. There's a whole music therapy program at Boston Children's Hospitals. There's 3 or 4 in Rhode Island, and I think there's about 5 or 6 in Connecticut. So it's definitely a growing profession. There's definitely more like west of here or south of here. But by the time that I get out of grad school, there's going to be job opportunities, which is really exciting. Yeah, did that answer? What are some of your favorite songs to sing? I like the Hello song a lot.
Yeah.
My friends know.
Yeah, she does.
Yeah, she does.
There's a song, I don't remember how it goes, but there's a song that goes, it's a goodbye song. I like the lyrics of it. It incorporates like, see you later alligator, after a while crocodile. It's bye bye butterfly, out the door dinosaur. There's a bunch of them, and it's like this whole like goodbye song with that, so I really like that one. There's a lot of kid songs that nobody else knows because my aunt wrote them, and I love those. We're on the bus.
You like the Hoppy Frog song?
Oh yeah. Pop out with the little green frog one day. Pop with the little green frog. Pop with the little green frog one day. But his eyes are pop. Woo! That's a fun one.
Nice.
Call and repeat songs are great too. So like, there was a bear. Great big moose. Those are great just to see if they can like get the words. Oh my goodness, there's so many, but those are some of my favorites. What if you have a patient who dislikes your sessions? I don't know if I'm qualified to answer this question yet.
That's a fair enough answer. It wasn't my question, but that's a fair enough answer.
Yeah, I don't think I'm qualified to answer that yet. Sorry. What skills does music therapy help improve in its patients? I think I answered that in my presentation.
Yeah, you did. I'm sorry.
Great. Yeah, I answered that one in my presentation. How far can music therapy help someone physically, mentally, and emotionally? How far can music therapy help someone physically? Very far. Like, I don't know, like, if there's like I don't know the scientific, like, research-based answer to that question yet. But, like, if you think about us, which we are considered neurotypical and regularly developing, and you think about how music affects us physically, mentally, and emotionally, and then imagine somebody that can't necessarily understand the world around them, but they can understand music, and just imagine how that person is affected by that music, physically, mentally, emotionally, and it's to the extremes. Are there therapy standards? Yes. The American Music Therapy Association and the Certification Board for Music Therapy has a list of standards for education, and also continuing education. So like music ed, you'll have to do like continuing education hours. Music therapists have to do the exact same thing. And there are several standards. There's also, along the lines, there are different kind of like branches of music therapy that you can get like different certifications for. So like neurological music therapy, which is very helpful with like stroke victims and any sort of brain damage, cognitively, motor dysfunctions and sensory dysfunctions. And then there's guided imagery music therapy, and then also Nordhoff Robbins music therapy. So there are several different ways to go with this. How can you answer that? Client versus patient. What did you mean by client versus patient?
Okay, well, like when you were,
Client versus patient.
if everyone would refer to the myth versus reality area, maybe it was. Okay.
Are you referring to the terminology if there's a
Yeah, I was
difference
just
between clients
curious,
and
like,
patients?
what the difference was, because you said client or patient most of the time.
Yeah,
I was
so
curious the distinction.
there isn't really a distinction. I would say client if you're like, it's like private practice or in a school. I would say patient if they're hospitalized or in an institution.
Gotcha.
So, how can it help Parkinson's? That would fall under neurological music therapy, and I don't know the exact ways that it helps, but it's definitely an interesting thing where it's helping with different like brain neurons with music and reconnecting them, or just kind of like helping a person calm down. And like, because Parkinson's is like you.
Yeah, I was really curious because like my piano teacher, he got Parkinson's, and so I was curious if there was like a therapy side of that, like, I don't know.
Yeah, I don't know exactly, but it would definitely be related to neurological music therapy.
Gotcha.
Also, as Sarah mentioned earlier, music releases dopamine, and one of the current medicines for Parkinson's is L-Dopa,
Yes.
which is a boost of dopamine, so that's what is currently the only temporary help for people with Parkinson's. So, yeah.
And that is the end of the cards. Does anybody else have any questions or comments or observations, anything? Kyle?
Have you sat in on a music therapy session before?
I have. Junior year of high school, I was in an internship and I got to observe a music therapist. She worked in school, so it was an elementary school. And she had group sessions and individual sessions with students with different disabilities. It was really cool.
What influenced you to pursue music therapy?
I know the answer. So forever I wanted to be a special educator. So my mom's a special educator, my sister's autistic. I always volunteered with Special Olympics. I did adult special needs camp as a counselor. But then my freshman year of high school, my choral director was like, "Have you heard of music therapy?" And I hadn't, because it's still this new career that many people don't know about. And so it actually so happened that that same time that she asked me that, we were starting our career projects in my computer lit class. And so I did my career project on music therapy. I got to interview the music therapist, actually the same music therapist I worked with my junior year. And I kind of fell in love with the idea. Music has been a part of my life forever. But I knew I wanted to work with kids with disabilities, so it just kind of fit, and there was like something that just like clicked. And so then throughout high school, I took as many opportunities as I can to sit in on music therapy sessions, volunteer at nursing homes. I was playing more music with my sister, and I saw the benefits of it, and I just absolutely loved it. Right.
Why are you wearing shoes?
That's your burning I don't like shoes, and also I was overheating, so I took my shoes off.
Okay.
I wasn't sure if it's like,
I don't like shoes. No, I just don't like shoes.
It's part of the
Although
profession.
one of the music therapists in one of the videos wasn't wearing shoes, so.
Was that the second
Yeah,
video? Yeah, that was because of all the mats.
yeah.
I want a practice that has a room like that. So that's like my dream, like private practice, having a sensory room like that.
I have a question about sensory rooms. So that sensory room I saw had a lot of things that were used for like physical needs and stuff, but it also had a lot of bright colors and the very textural mats. Could that end up being a negative effect on some patients
Absolutely.
or clients because
Yeah.
of the texture, and because you mentioned like the texture of the wall, texture of pens, lights, different things that
Yeah.
could.
That could absolutely affect. So one thing that I've learned is when an infant, the first colors that they see are black and white. And so a lot of teachers, like, they bright up their classroom and they have lots of different, like, bright colored posters and, like, different colored, like, desks and just colors everywhere because you think that kids love colors, but actually all the colors can be distracting to some kids. And so it definitely depends on the client. So I don't know, she may have a second sensory room that has less colors, but it can definitely be distraction. Depends on the client, of course. Corinne?
Do some music therapists, if it's better for a child or for a patient, do they go like make house visits?
Yeah. Cool.
Is there a certain point at which you potentially call off a session because it just isn't going correctly that day?
Yeah, absolutely. I was actually in a music therapy session when the child was just kind of like over the top and there was like no reasoning with this child, and so we just sat, like we just stopped the music interventions, and this person just kind of like sat and like ended and moved on with their day. So it definitely, like, all this stuff depends on the client, and there are definitely moments, like there are some days in class where I personally just can't do class, and so I'll like just like walk out, take a break. And so there are definitely those moments where you just need, it's not working, and that is acceptable.
Cool.
Any other questions? Okay. Cool. Thanks, guys.